My dear budding doctors, I welcome you all to my YouTube channel, Medicos Notes. So, today I have started a new series which is the important short answers in upper limb. Already, we have discussed the important short answers in general anatomy, so you can check out that video which is in the page. This video will be actually in three parts. Each part will be having a set of five questions. So, altogether, this 15 questions, you will be almost thorough with the important 2 marks that is needed to be know for um, university exams. Okay, so let's start with the video. So the first question is a clavipectoral fascia. Okay, so the clavipectoral fascia is a deep fascia extending from the clavicle above to the axillary fascia below. Okay, so it is a deep fascia extending from clavicle above to axillary fascia below. It is situated deep to the clavicle portion of pectoralis major muscle. Okay, so this is where it is located. So it is located deep to the clavicle portion of pectoralis major muscle. So here the upper part it splits to enclose the subclavius muscle. Okay, and the lower part it splits to enclose the pectoralis minor muscle. Okay, so the upper part it splits to enclose the subclavius muscle and lower part it splits to enclose the pectoralis minor muscle. So the clavipectoral fascia is pierced by cephalic vein, thoracoacromial artery, lateral pectoral nerve, and lymphatics. So the fourth point is very important because it is itself a separate 2 mark questions, a very important 2 mark question which has been asked repeatedly. So the fourth point is the clavipectoral fascia is pierced by cephalic vein, thoracoacromial artery, lateral pectoral nerve, and lymphatics. So we'll pass on to the next question. Okay, so as I have already told, the structures piercing clavipectoral fascia is a separate 2 mark question. So the mnemonic for that is called. Okay, so C for cephalic vein, A for thoracoacromial. Acromial. This I have chosen as a the A from here I have chosen as a mnemonic. Okay, so thoracoacromial artery A, then L for lateral pectoral nerve, and the next L is for lymphatics, which is passing from the breast and the pectoral region. So it's a very important 2 mark question. Please note, my dear friends. Okay, so the next question. So the next question is the branches of a radial nerve in radial groove. So the radial groove is nothing but it is a shallow depression. Okay, it is a shallow depression in the posterior surface. Okay, along the lateral border of the humerus bone. So why there is a depression here? So this depression is for the passage of the radial nerve and the deep brachial artery. Okay, so that is the radial groove. So the question is the branches of a radial nerve in radial groove. Okay, so it has motor branches and sensory branches. So first motor branch. So in radial groove is only the question, but I have also mentioned above radial groove and below radial groove because if they asked a question as above what are the branches of radial nerve, above radial groove also you can answer it, below radial groove also you can answer it. Okay, so above radial groove the motor branches is the long head of triceps and the medial head of triceps. Okay, so in radial groove was is what the lateral head of triceps and the medial head of triceps and anconeus. Below radial groove is the brachialis, brachioradialis, extensor carpi radialis longus, extensor carpi radialis brevis, and supinator. Okay, so that is the below radial groove motor branches. So please take a screenshot of this. Please save this so it will be useful for your exams. Okay, so the next is we'll be looking on to the sensory branches. So sensory branches above radial groove, what? It is the posterior cutaneous nerve of which is the lateral cutaneous nerve of arm. Okay, so in radial groove it is the lower lateral cutaneous nerve of arm and the posterior cutaneous nerve of forearms. That is the in radial groove. Then below radial groove is what? And the superficial branch of radial nerve, which is the dorsal radial sensory nerve. Okay, so yeah, this is an important question which is repeatedly asked. So you can draw a diagram of radial nerve. You can also draw this diagram. So it will be when the examiners are looking at this diagram, so they will give you 2 marks. Okay, so it is a very important diagram. Please, if you only learn this diagram itself, it will yield you 2 marks. Okay, so it is an important question. Motor branches, sensory branches. So above radial groove, in radial groove, below radial groove for both. Okay, so please take a note of this question. Okay, Then next question is rotator cuff. So what is the rotator cuff? So rotator cuff is a musculotendinous cuff of shoulder. Okay, it is a musculotendinous cuff of shoulder. So rotator cuff is actually formed by four muscles. Okay, tendons of four muscles. Okay, it is formed by tendons of four muscles. What are the muscles? It is subscapularis, supraspinatus, infraspinatus, and teres minor. So supraspinatus, infraspinatus, subscapularis, and teres minor. Okay, so the tendons of all these muscles together form the rotator cuff. Okay, so the cuff, it arises from the scapula anteriorly and is inserted into the lesser and greater tubercles of humerus. Okay, so it arises from the scapula anteriorly and is inserted into the lesser and greater tubercles of humerus. So what is the function of this rotator cuff? It provides strength and support to the shoulder joint and the capsule. Okay, so the important function is to provide strength and support. So this is the rotator cuff. It is also an important question. Please take a note of it. You can draw this diagram. You can mark the parts. Yeah, no, as your answer gets more colorful and as the diagram is more visible for the examiner, they will give you more marks. Okay, so that is anatomy. The diagrams only yield you marks. The next question, anatomical snuff box. So in this diagram, when you see, here is the anatomical snuff box. Okay, so this is the anatomical snuff box. For your better understanding and visualization, I have inserted this diagram. You need not draw this diagram in exam. If you want, you can also draw. There's no any problem in that. So this is the anatomical snuff box. Okay, so what is anatomical snuff box? It is a triangular depression in the lateral aspect of dorsum of hand. So triangular depression in the lateral aspect of dorsum of hand is the anatomical snuff box. Okay, so it is also known as radial fossa. It is also known as radial fossa. So what are the boundaries? So here, this triangular region is the anatomical snuff box. So the boundaries of anatomical snuff box are medially what you can see, it is the extensor tendon of, so these are the tendons. Okay, tendons of extensor pollicis longus. So the tendon medially, it is tendon of extensor pollicis longus. Then what is the lateral? It is it has the, it is surrounded by tendon of extensor pollicis brevis and tendon of abductor pollicis longus. Okay, so laterally, the extensor pollicis brevis and abductor pollicis longus. Floor is of scaphoid and trapezium bones. Okay, so the floor is scaphoid and trapezium. Then the contents. So what are the contents of anatomical snuff box? So doctors, this contents of anatomical snuff box is itself a important 2 mark question. Okay, so please take a note of, take a screenshot of this, keep it, or always remember, always revise, so you will be you can thoroughly remember in the exam hall all these short notes and answers. Okay, so contents of anatomical snuff box. Mnemonic is cart. So C for cephalic vein, A for artery, which is a radial artery, R for radial nerve. So the radial nerve, superficial branch. Okay, so R for radial nerve, and T for tendon of extensor carpi radialis longus and brevis. Okay, so the mnemonic is cart. With this mnemonic, you can remember the contents. So boundaries are also important. This diagram is altogether very important. If you draw this diagram, mark the parts, itself, you will get 2 marks. Okay, so the diagram is important, the contents are important. So 5 questions we have covered. So okay, so that is with this video. The next videos I'll be covering again 10 more questions, which is very important for you. So please wait for the videos. Please look into the videos and learn thoroughly. All the best for your exams, and you're going to perform very well in the exam, and you're going to rock the exams. Okay, so thank you, my dear doctors. Thank you.